If I could hit the reset button on my nursing career, there are so many decisions I'd make that would make my journey easier and faster. Welcome to my channel. My name is Nina with an N, and in today's video, I'm going to be sharing with you things I wish I knew before starting nursing, as well as things I'd do differently if I were to be starting nursing all over again. Whether you're thinking of becoming a nurse or you already are one, I have some tips that could help you navigate your nursing journey a lot better than I did my own. So grab your coffee or your matcha and let's get into this. Ignore my hair, but first of all, I wanted to talk about how I got into nursing. I don't think I've really talked about it on my channel a lot, but my path to becoming a nurse wasn't straightforward and easy. I didn't start out in healthcare. I actually went back to school in my mid-20s. I have some videos on my YouTube if you're interested in watching my nursing school content. My first degree was in Korean, and then I decided I wanted to go back to school to pursue my high school dream of being a nurse. When I was in high school, when we were deciding what career paths we wanted to go, I really wanted to be a nurse, but I felt like I wasn't smart enough to be a nurse. Korean would be easier. It wasn't. So ultimately, I decided on a Korean major. I kind of gave up the idea of being a nurse for a really long time. And then after going to grad school for a few semesters and teaching Korean language to elementary school kids, I realized that that career path didn't serve me and I really didn't like it. So I kind of did some reflection. After spending some time figuring out what I really wanted to do, I realized that nursing was where my heart was and came back to the career choice of becoming a nurse. I've been looking into nursing schools, particularly the accelerated courses. After a couple weeks of contemplating nursing, I'm leaning towards it 90% right now. So I took my prerequisites. I enrolled in an accelerated program. And after 16 months of blood, sweat, and tears, literally, failing my first med-surg exam, crying on my way out right after taking my NCLEX exam. Here I am today. 3 years later, I am a nurse. I've been a labor and delivery nurse for 3 years now, which I think is absolutely mind-boggling. That brings us into our next quick topic. A question that I actually get a lot is how I got into labor and delivery. Throughout nursing school, I actually thought I wanted to do pediatrics or dermatology or aesthetics, but during my clinical rotations, I actually really enjoyed my women's health, my OB rotation the most. I thought I wanted to be a mother-baby nurse, but after shadowing as a labor and delivery nurse while interviewing, I actually realized that I love labor and delivery a lot more than I do postpartum. I enjoy that you can never expect anything in labor and delivery. Every day is different. I was honestly also super lucky because the hospital that I currently work at accepts new grads. I know a lot of hospitals don't, but there are some out there. There were maybe like 4 hospitals around me in the Illinois area that were accepting new grads. So honestly, it's just all about trying to find a hospital that accepts new grads. Now let's get to the part that I really want to talk about, what I would do differently if I were to start my nursing journey over again. The first thing I would have done differently is to network more. During nursing school, I always thought my grades were the most important, so I didn't really make many friends in nursing school. I think I had like a total of like 3 or 4 friends. If I were to restart nursing school, I would definitely make friends with more people, as well as network with my clinical instructors, my professors, and my patients. It's funny because one of my patients actually offered me my first nursing job. She asked if I could be her in-home nurse. Obviously, I didn't take it, but I just thought that was an interesting fact. I don't know if anyone else thinks like this, but I always thought that networking was only for business people, but that's not the case. Networking will not only help you grow your career, you can get their insight from their own experiences, and I think networking is just a really good way to broaden your views on nursing. One of my nursing instructors told me that the nursing world is a really small one. Everyone is connected somehow. And this very same instructor asked me to give her my resume because the hospital that I applied for wasn't getting back to me, and she said that she would put in a good word. On a job application, they don't ask you for your GPA. So networking is so much more important than grades. I'm not saying to fail out of nursing school, but your network is a lot more important. The second thing I would have done was I would have shadowed more units or had prior experience prior to nursing school as a CNA. Getting hands-on experience before diving into nursing nursing school is so important, and it would have been helpful because you could see what nurses actually do on a day-to-day basis, especially in different units that you're shadowing in. It would have been really helpful in letting me figure out what unit I would have wanted to go into, and it would have helped me to commit to a specialty earlier on in my career. Most hospitals actually allow for shadowing. I know a lot of us don't think that they would, but just call a hospital, ask to speak to a charge nurse on the specific unit that you want to shadow, speak to your clinical instructor, see if she'll call the charge nurse for you. We actually had a nursing student recently who was on her capstone rotation. She was on some random med surg floor. She really wanted OB and she knew that she wanted OB. So she spoke to her clinical instructor who called us, and I think we had her for like a few weeks.
She graduates soon, so hopefully she starts working for us.
I think shadowing is a really good way to find which specialty or which unit you want to go into, and it never hurts to ask. If you think about it, I probably wouldn't be a labor and delivery nurse if I didn't shadow in labor and delivery while interviewing. The third thing I would have done differently, I would have focused on self-care sooner. I, to this day, still struggle with figuring out what I like to do outside of work, and I feel like had I figured out my hobbies sooner, it would have helped me relax at home. One of the things that drew me to nursing is that nurses don't take physical work home with them. I did realize very quickly that we do, however, take home emotional baggage. So I realized so quickly that nursing is so demanding both emotionally and physically, and your patient outcomes take a toll on you emotionally. In the beginning, I pushed myself a little too hard, and I always thought I had to be this perfect nurse. I was spreading myself a little too thin because I didn't know how to delegate at work, but that's beyond the point. And the truth is, burnout is real, so finding a way to get your mind off of work when you're not at work. Taking care of yourself is not a luxury, it's essential to doing your job well. If you're not taking care of yourself, how are you going to take care of other people? So, moral of this story, find something that you enjoy doing. It could be shopping, it could be cooking, taking a walk, working out. Find someone who you like to spend time with. For me, it's Jake, my husband. He's been such a big help throughout my whole nursing journey, nursing school, my nursing career. Someone I can talk to and just get my mind off of work with. The last thing I would do differently is I would not ever doubt myself. Nursing is so tough. There were so many moments early on and even now where I second guess myself and I doubt myself. I always question whether or not I'm doing the right thing or doing enough. The imposter syndrome is real. I almost didn't become a nurse because I doubted myself. Had I not doubted myself in high school, I would have been a nurse for maybe like 8 or 9 years now. It's mind-boggling to me that I could have started my nursing career sooner. But anyways, that's not the point. Truth is, these doubts that I wasn't smart enough, that I'm not doing enough for my patients, they don't serve me. And I feel like I'm always proving myself wrong, whether it be on the unit or at home. I recently got certified, and this whole time that I was studying, even though the information on the exam is things I see almost every day at work or things that I'm educating my patients on almost every day at work, I kept telling myself that I did not know this information and I would not be certified and I needed to freak out. It just made me more anxious, and hindsight is 2020. I passed the exam. I honestly have no idea why I doubted myself so much. We just need to give ourselves grace, trust in ourselves as well as our preceptors if you're a new grad, and just trust that you know more than you think. If I could go back, I'd tell myself to trust the process. I'd tell myself to trust that I was capable enough and smart enough and to just keep going. Do the thing. To anyone who's watching that's considering a nursing career, do it. Just kidding. Honestly, I would really find out what it is to be a nurse. A lot of bedside nurses regret their decision, so really look into what it's like to be a nurse. If you want to see day in the lives, you can see my videos on my YouTube channel to see what a labor and delivery nurse actually does day to day. Although nursing is tough, it is very rewarding, and I've learned a lot through this journey, especially about myself. Whether you're considering a career in nursing or you're just starting out, there's no right way to start your nursing journey, as you can tell by mine. I hope some of these tips can help you make your journey into nursing a lot easier and smoother than it was for me. And if you have any questions about nursing, please feel free to leave a comment down below. I'll do my best to answer. I am not a nursing expert, but I will try to answer them to the best of my ability in the comments below. And if you're already a nurse, I'd love to hear about your experiences. How did you become a nurse? What do you think about nursing? Would you become a nurse again if you had to? What would you do differently? If you enjoy this video, I post nursing lifestyle content as well as self-care and a little peek into my life as a labor and delivery nurse. So if that interests you, please watch my other videos. Good luck on your journey and take care of yourselves. I'll see you in the next video. Bye!